everyone, and welcome to another episode of Teeth Matter. This is your host, Ellie Halabian, DDS, and in this episode, we've got Stephen Liu. Dr. Stephen Liu is our favorite Fresno dentist. He's been in public health, very similar to myself, and recently transitioned into private practice. Listen to our conversation about what it means to work in public health, what can you expect, are you a good candidate after residency, after dental school, and what it's like to transition into private practice. Good morning, Stephen Liu. Dr.
Good morning.
Stephen Liu. It's so nice to have you.
Yeah, thank you for having me, Ellie. Appreciate it.
Of course, I'm so excited. You and I have been talking on Instagram quite a bit recently, and we're, I think, kind of in the same place, or I'm just maybe a little bit behind you, but I feel like we are gravitating in the same direction.
Mm-hmm.
And I think today we're going to have a lot to talk about. So I know your story a little bit, but the followers don't know. So if you can tell us a little bit about yourself, where you did your training, when you graduated, and where are you now?
Sounds good. Yeah, Ellie and I talked a little bit before this and on Instagram too, but I graduated in 2020 from University of Michigan, and then right after I went to a FQHC in California, in Central Valley, Fresno specifically. I was actually open to a lot of different practice environments. I applied to PDS, corporate environment, applied to private practices in the Bay Area, and I put my resume on the health resource, the HRSA website, HRSA, like Health Workforce Connector, and then the recruiter reached out to me there, and then it was a good salary, it was good benefits, so I was like, okay, let's do it. It's a good place to learn, good place to get started and get paid. So after that, I worked for 3 years with them. After the first year, I applied for the $50K loan repayment with the state. Every state actually has it. But the $50K one with California is pretty strict because I did apply for the $300K one in California, and I believe that program is the biggest program out of all the states, because $300K is a lot, and they get most of the money from the tobacco tax in California. It's for physicians too. I don't think a lot of people apply for it, so if anyone is interested in staying in California and doing public health, that is a really good way to pay back your loans. But anyways, I wasn't able to accept it because I was already on the $50K one, and whatever. I'm glad actually to be out. It was kind of stressful to be in FQHC, as Ellie and I have talked about, but we'll touch more about that as time goes on.
Yeah, so exactly, FQHC, a lot of people don't know what that is. You and I are both,
right.
Have both started out in that kind of environment. And you mentioned something about loans, so can you just dive a little bit further into what that is? What is an FQHC? What are some benefits of being in an FQHC?
Right. I didn't really go into that because, a lot of our colleagues don't know what an FQHC is, and it wasn't even on their radar in terms of practice environments. So FQHC is a federally qualified health center. It's usually a community health center. It's very similar to the ones you externed at as a dental student. And the environment is, I think it depends on the clinic, but they take most insurances, mostly Medicaid patients, and the way they make money is based off encounters. So if more patients show up, that's the tally of patients that they can get more pay for, and on top of their insurance payout. But that creates a high volume. That creates like 20 plus patients a day. And where I was working, there wasn't a hygienist. They actually had hygienists before. Then they laid them off. So now we were doing all the profis and SRPs. So in terms of loans and stuff, you can also do NHSC, but you have to apply for that while you're a student most of the time. And then you can get all of it paid for, or you can do the student to scholar the S2S, whatever it stands for, and get 120K for 3 years. So yeah, I have a lot of coworkers who did that or had the whole 4-year scholarship. But yeah.
Yeah, I mean, that's one of the reasons why I joined an FQHC was the benefits, and also the fact that there was a salary. I mean, I did residency. It doesn't sound like you did residency. You went straight into work, right? I did residency, and I was like at the highest clinically. I felt like I grew so much in that 1 year, but I still felt like there was still a little bit of room. I was too afraid to take on the responsibility of private practice. And I thought maybe I could get my reps in, I can do good, and then I also have a salary. And this way I don't have to worry about production. And I think that was one of the major reasons why I went into FQHC. But like you said, high volume, they go based on numbers. Ultimately, it's still a business, right? It's public health, but the actual focus is business. So that's one of my frustrations with this work environment. I don't know, what were some other obstacles you faced? Because like I said, FQHC is supposed to be serving underserved populations, kind of like filling in the gap of geography, lack of resources, education. But then when it comes to delivering optimal care, I don't necessarily think that, not that I'm not giving the best care I can, but I don't think it is the best practice.
Oh my gosh. This is why we resonated on Instagram, because that's what you just said was exactly how I felt. Because, yes, you have the ability to help these people, but is it the best way? Like we mentioned, having 20 patients a day, and then there's people that walk in and they need help. They have a swelling, and oh crap, like that has to be taken out, or pulpectomy or something. But you can't even take on every single like pulpectomy patient that walks through the door. Like it's not feasible. You don't have enough staff for it. It's going to stress you out mentally. And if you're stressed out, you're likely not able to do things correctly. So I think that is the frustration of being in public health, is that you realize there's so many people that need help. And I think being a people pleaser as healthcare professionals, because at the end of the day, we want to help people, right? That's usually the first thing we think about when we even sign up for this profession. And it takes a toll on you mentally that like it's tough to balance everything.
Right.
Yeah.
No, that's absolutely true. People pleasing was actually one of my episodes a few episodes back, but we are people pleasers. We can't.
Oh yeah. I listened to that episode.
Amazing. Whoever hasn't listened, you should listen to it too. But definitely, like, people pleasing is part of our nature. And like, I get people who walk in, because we are also still a walk-in clinic, right? So you have these people walk in and they're like, emergency, and we have to take on the emergency. And the system is so messed up, because you have the 20 patients a day. I'm double booked every half hour, 4 procedures and like comprehensives. It's so every half hour slot, I'm double booked. Okay, and then I have emergencies added onto that list.
Dang, it's half hour slots.
Half hour slots for me.
Yeah.
Yeah, I mean, yeah.
I guess it doesn't even matter because the time slot doesn't even matter, because it's still patients at the end of the day. It's 45 minute, 90, whatever. It's still a bunch of patients.
Yeah. And so I want to help everyone, but I realize like I'm not a superhero. Like I only have 2 hands, and I only have this many number of assistants. We're relatively short staffed. Like it burdens them too. They can't be there helping me and sterilizing and bringing in a new patient and taking x-rays. It just doesn't work. There's a big issue in this FQHC system that needs to be addressed, but that's out of our control. But it sounds like one of the reasons you left was the burnout, right? Is that what made you transition into private practice?
Yeah, I was telling myself, man, I would take any job and get paid less, just to get out, But then now I'm missing the salary, and now I'm missing the benefits. But I am more fulfilled now in other aspects of my career, which is fulfillment, learning, and relationships with the patients and the team. So I do really appreciate that. But I was going to touch upon a point that you said about like the system when you're seeing patients, for example, like doing your best work, right? Like patients come in and the best thing to do is probably a crown or whatever. But that takes multiple appointments. And for example, if you're booked for a composite and it's a 4-surface composite, like, man, like, are you gonna spend the time and do etch bond, and you don't have an assistant to help you out, so you use isolite. So what do I opt for? I have to opt for resin modified glass ionomer. It's not the most strongest material. It gets the job done, and then you feel like you're not providing the absolute highest quality of work, right? But that's how, like, I learned how to manage and cope with it. That I, like, a middle ground between providing the best work I can, balancing what I can give to the patient and my mental health and how the system runs, like how I fit into that system.
Right. No, that's an issue too. I mean, that's another thing, resources. And a lot of it, resources, like material-wise, we don't have a lot, number one. And number two, like patients can't afford it, even though we are a public health clinic, and it's a sliding scale fee.
Right, we have that too.
Yeah, it's a sliding scale fee, meaning like depending on the patient's income, they fall into certain buckets, A, B, C, D, and based on that bucket, they get a certain discount. So that's supposed to help them kind of achieve certain care, right, or attain certain care. So if like they wanted a crown and they can't afford it, they might be able to afford the $75. But then again, like, and where I'm located, they can't afford it, and so it ends up being a lot of patchwork. And then I feel like I'm not doing the dentistry that I want to do, and I'm not doing good work because ultimately that patchwork is going to end up failing.
I totally agree.
Yeah, so I'm not seeing the results I want to see. I'm not completing as many cases I want to complete, and that's frustrating me as a professional now, because now I'm in my first year of practice, true practice, like outside of residency. And I want to build skill. I don't want to just do patchwork and then think like I'm a shitty dentist.
Right. Oh my God, I freaking resonate with you again. Like, even though, like, I'm getting paid less now because I got switched from production when I first joined private, and it was good. It was good, but we switched back to daily guarantee so I can focus on the learning the protocols. Now it's less than FQHC, but what did we? I already forgot my train of thought about resonating. Oh, the quality,
quality.
patchwork. Is the system that you are in, does it give you the opportunity to have the time to implement like a good workflow, right? Like you said, resources, and sometimes cases don't get finished because you're doing a root canal. You have to do step by step. Like at my clinic, they would split it up like so inefficiently. You open it up, bring them back, and then after that you do like canals, like the shaping of the canals. The next time obturate. The next time core. Next time crown. Like, how slow is that? Yeah. So you don't really get the workflow down, like in the real world, aka private practice or whatever. And to touch on the fact like how you view yourself perspective wise about like how you are as a dentist and reflection of the setting that you're in. And I did feel like, oh man, like being in public health, I don't feel like I'm doing the best dentistry I can, and then I feel like a bad dentist. Like, right. You go to dental school, you learn these things, you learn to recreate smiles, give people like a whole new set of teeth, but right. you don't feel like you're doing that. Like you said, you feel like you're doing patchwork that doesn't last, right. And you're just like you feel like a tooth mechanic.
Yeah, that's a good way of putting it.
Yeah. Exactly. So I resonate with that.
Yeah. No, and so What was I was gonna, sorry, I'll cut this out, but,
Yeah, no problem.
that's how I feel. I feel like a tooth mechanic. And now I want to learn how to do those smiles because, like we said, we were talking about this offline. It was like we would see on Instagram that like a lot of our friends or maybe people who are a couple of years ahead of us are having, work in private practice. They're creating these full mouth rehabs. They're doing these transformative dentistry. And it doesn't make me feel good because I'm not doing that today. I want to do that, but I'm not doing it today.
Yes.
And I also don't feel like I have the knowledge or the experience to create that smile right now. I want to get there. So now that you are in private practice, tell me a little bit about like what you're doing. I know you share a lot of the work that you do, like a lot of redos and like a lot of different plays with material. Tell me a little bit about how you're changing, the way you do dentistry.
Oh, that's a really good question. I think in public health, I did work with other doctors, but we didn't really discuss like the way we do things. So I just truly felt like I was just there alone and I was figuring things out by myself. So I would watch a lot of YouTube videos, CE videos, and then, the good thing about my FQHC was that you can order whatever you want within a reasonable budget, but you can order whatever you want. But that would probably take like a reasonable amount of time, however long it takes to ship, 2 or 3 weeks. But 2 or 3 weeks, I don't know, I kind of lose my motivation to implement the material by then, But the change in my, okay, you asked the change in like the way I do things?
Right,
like
change in the way you do dentistry.
Okay. I think the thing in private practice, from what I hear from my other friends too, is that you kind of follow that private practice's protocols. Even though when you go into private practice and you're treating like a different population of patients, you kind of are, I feel in a sense, more limited in how you practice dentistry because they want you to practice dentistry a certain way because they have been successful at it. And I totally agree with that mentality because you go to join a successful private practice, there's a reason why they're successful and the things work, the materials work. So I learned from my boss / mentor about how to do composites, and that was like the hardest freaking thing to like get down. And every dentist will agree that class 2s are like the hardest thing to do. And what's even worse is that we take bite wings after every class 2, and I've never done that. We never done that in school. We never done that for boards, which actually makes more sense to get licensed, right?
Yeah.
But we don't do that. And visually, even if you have very high magnification, like you can see that it looks smooth, it feels smooth, and then you take an X-ray and there's like an overhang, but it's smooth into the class 2. Will it work? Yeah, but we just like practice like at a super high level, so it just makes me feel bad and not making it perfect. And my boss does it so easily, and that transition was difficult to get that workflow down. But yeah, I think that's the difference in dentistry from moving to FQHC to private practice, on how I do things differently now, which is basically following what he does, what my boss and mentor does.
So, I mean, it sounds like your boss is your mentor, and you just said my boss mentor, that's what he does and how he encourages you to take x-rays afterwards. Was he your mentor prior to you transitioning into private practice, or did you like apply for a job and then he was like, oh, I'll provide mentorship? How did that happen?
No. I mean, I was looking for jobs like as my loan repayment contract started getting closer, and going to these CE courses, I would tell people, hey, I'm looking to go to private. Keep an eye out. I was just like actively looking around while I was winding down. And And then I found his listing while I was still like months away. I followed him on Instagram, saw his work, and then when I was like about a month or two away from leaving, I applied, interviewed at 2 different places, and then I got a good vibe from my current boss because I felt like when you just click. I knew that it was a good vibe and that he would mentor me, but he didn't like say specifically, oh, like in the listing, like mentorship provided, because I don't know if that actually is true for those listings, right? But I can tell that he loves to teach type of thing just from the conversation. So I just knew from a gut feeling that I would probably learn a lot here, and that was absolutely what happened. But I think, just talking to you, I feel like we're going through the same path. And I talked to some other dentists on YouTube too that transitioned from FQHC to private, and we need to build like a community of these people, of us that switch, because I think we have a really unique perspective.
Definitely need a support group. I really think it's necessary for my mental health because going into work is such a high anxiety. I don't know. Every Monday for me is just like, oh no, I'm going to battle again, and I don't want that to be my life. I'm doing this because I care for people, not because I want to resent people, and
that's a really good point. When I worked in FQHC, I started seeing people differently. That's a really good point you made. Like, actually, the population is great that I worked with, but I did start to see the world differently, that, like, people just cared about themselves, and that was how I thought. Like, so I had a therapist during my time, plus, the benefits. Why not?
Yeah.
I don't have it now. I don't have a therapist now, but it definitely changed my viewpoint of people, and you start going down a dark path. It's just like the system really messes with your mind, the way it's set up, and how you view yourself.
Yeah. No, it's definitely, I guess, on somewhat corrupt, for lack of a better word, but. For you, when you transitioned out, how was your transition like? How did you prepare to say peace? Because most of these are contract based and they're like long-term contracts. So how do you leave a place like that?
I wasn't even sure if I wanted to go to private because I did hear horror stories about private. Sometimes it sounds worse than FQHC, right? Because everybody's personality as a boss or owner, employer is different. But during my FQHC, I would tackle as many difficult cases as I could. One, your patients do want you to do it, and I would also request from my directors to block out my schedule if I'm going to do bigger cases. They don't really allow it for root canals because it's already in the system, but I wanted to do aesthetic work for this patient from 5 to 12, and then I asked them to block it out, and they did. But I haven't really done too many of it, so I had to redo the temps because it broke off or something, and then I had to cut it off, and another time and I didn't request it blocked off that time because one, I didn't expect it to happen, stuff like that. So I think a good way to approach the transition is to really use it as another residency. I mean, you've been to residency before, but to get the reps in of what private practice work would be like. A lot of crowns, root canals, surgical extractions, composites, right? Composites will always be the bread and butter of dentistry. And for our office, since it's fee for service, the composites basically make up a good amount of what comes through the door, and then diagnosing for SRP, stuff like that. Oh, a really good tip is having a camera. We had an intraoral camera, But like if I went to a private practice that didn't, I would just go on Amazon and just like fill up each room or one room with it and just keep wiping it because it's like $100. But that has been like the single easiest way to convince patients of the dentistry that they need, and they never see what it looks like up close. But once they do, they're like, oh yeah, that's clearly a cavity. Oh yeah, that's clearly broken. So that's so easy to like just present treatment. Yeah. And another thing I did to prepare was take Arrowhead's new dentist program for any new dentist graduating within like 10 years of graduation. They provide 4 courses for I think $6,000, and you get like 60 CE credits, which is like a crap ton for that amount of money. And it was about full mouth rehab. That's something I wanted to do, but I realized when I went to the course that it was the most important thing I learned from it was patient communication and selling treatment to patients. I don't want to use the word sell, but we are selling an idea to the patient that they need something, but they don't want it. But you have to you basically teach them how to want the dentistry that they truly need for themselves to help them get to a better place in dental health. And another thing was learning about occlusion. And when you're doing more like bigger cases, it's important to understand that. And even in composites, like how the teeth come together, and if you're doing a full quad and doing efficient dentistry, that's really important to know. So when I was in FQHC, I feel like, I was doing one composite at a time, one tooth at a time. You don't really think about occlusion, or like our patient base, we probably see a lot of wear, right? And the first thing you see, like, oh, I want to help these people, otherwise it will get worse. But you have absolutely no idea where to start, And you could, you could still do it in. I know some dentists that do it in composite, and you can still treat it as a transitionary phase. And in FQHC, it would technically work, right? You think about doing patchwork dentistry, that's going to fail. Well, how about we try and do FQHC composite, like full mouth makeovers? That will probably help them more than what we do on a daily basis, right? So I think that's a good way to get our skills up in the meantime.
Yeah, continuing education is really important. I feel that I definitely need to find some good courses for occlusion, for facial aesthetics, in order to be able to actually survive in private practice, if that makes sense.
Right, yeah.
So I'm thinking about doing that. So I'll look into the courses you just mentioned.
Yeah, I'll send it to you. I think it's the single best investment. Like, even if I didn't get money back from it yet, it's just like the mindset from it, meeting other people, and just getting an idea of what it's like out there.
Right. Yeah, no, I just went to a continuing education course back in June in Houston, and I met so many people, like from all different parts of the country, actually some from Canada, and some were like international, and it was beautiful because everyone was on a different path. And then I was like, you know what, Ellie, you're not far behind. Everyone's like, there's a 70-year-old guy there, and then there's me. He's been in practice for X amount of years, and I just started my first year. So like, if he's interested in this course and he's here to learn, then clearly there's something that he's lacking in his skill or in his practice. And so like, Ellie, don't compare yourself, because ultimately everyone is learning. It's still learning. So it was a bit of a relief, to be honest.
Yeah, that's a good point. But I think it's really hard for us not to compare. One, for what it takes to get into dental school, we have to be very competitive. So that's always with us for the rest of our lives, basically, to be competitive. And, when you join Facebook groups about practice owners, guess what they're doing? They're comparing their practice to other people's practices, like the furniture, how it's set up, like the type of dentistry that's offered, and income. Like, everybody still compares. So I think for us, it's really important to just step back. I'm still learning to do that, like every day I'm still learning to do that, not to compare, and just just see how far I've grown, you know.
Right.
And it's hard to do. It's hard to do.
How long have you been in private practice now?
3 months. Felt
3
like
months.
a lifetime.
Wow, congrats. 3 months is
Thank
big.
you. Thank you. I mean, it took 2 months to get the composite workflow down, but yeah.
I mean, I've been watching your work on Instagram, and I constantly message you, like commenting or like replying. It's beautiful, like the rework that you're doing. Whether it's you know, it takes a lot of effort, and it's frustrating, you know.
It's very it's harder to do than some other things. Like putting the matrix band on has got to be the hardest part. Like it looks closed, and you take an X-ray, and like my thumbs are not that strong. Like you think you're good with your hands until you try to do that, and you your loops start flying up when you're trying to do direct vision, and you're just so freaking annoyed. But yeah, just like yesterday, like I had overflow, and you're like, what? I thought it was closed. You know?
Yeah.
Yeah.
No, I look funny sometimes putting on the matrix, and I feel like my assistant might be judging me, like, why can't she just put a simple matrix on? But it's not easy.
Just like doing. Yeah. No, it's not
easy. It's not.
It's not easy.
But I love watching your stories. I love watching you do your work and sharing it. It's beautiful, and it shows me that like there's room for growth, you know?
Thank you. That means so much to me, really. Because I think like, oh, I didn't really like do it that well, or like it could be better. But hearing other people say that, and looking up to it, and just seeing it as a inspiration, it means a lot to me. So thank you for sharing that.
Of course, yeah.
Yeah.
And when you explain to your patients like a redo that you might need to do, how do you find that conversation? Like it must be a little bit difficult to have it, because sometimes you might feel like they lose trust in you.
Oh yeah,
but,
absolutely.
But so how do you go about having that conversation with your patients?
I mean, if they've lost trust, then I just absolutely just have to take it as a loss, and it has happened. Obviously, when I first started, 15% of my patients that I've treated, because I've counted the patients, have gotten the sensitivity because I was doing the bonding wrong. So guess what? They lose the trust, because someone who has 1,000 reviews on Facebook and they've never seen this guy before also looks young, and then the only time they have an issue is with the new guy,
right,
or they want to go back to the main dentist who has the name on the door, right? So what I tell them, well, I think my personality, I just act very confident, and I build rapport pretty well. Just their shoes they're wearing, ask them what they're doing the weekend, just find a commonality, and I think that's the best way to build trust. And I think that's a skill that can be learned, and how to build rapport. Mm-hmm. And I think even if you do mess up, they can still trust you, but to a certain extent. I think after the second time, it can be a problem. But I just tell them, I set them up, and I show them the x-rays, show them pictures, and I say that, okay, so not many people will do it our way, where we check our bite wings after restoration. But this gives us a chance to correct it right then and there, instead of 6 months down the road at the checkup. Oh, I now notice something different, and I'll do it then. But now we can have the opportunity to intervene. But obviously, I'll be backed up in my schedule, so I'll just say like, hey, you take it as a loss because it's a loss of production and it's a time in the chair. But I would want that feeling fixed, and for myself, if it was my tooth, and plus, you just feel more satisfied with your work if you do good work.
Absolutely.
Like, even if it's just a composite, it just feels better to sleep at night. Right?
No, I hear you.
So that's what I tell them.
I hear you.
Yeah.
So tell me, for someone who is, in public health and is like considering to make the transition to private practice, when would be like a good time to exit? When Like, is there anything that they should know beforehand, that they should consider beforehand?
You're not on the contract, so you can leave whenever, right?
I am on a contract, but it's at will.
Oh, okay. So because the state of New York, you can still leave whenever.
Right.
I think that's really, really good because you're not on a loan repayment contract. Because if you're on a loan repayment contract, you're stuck, essentially. And when you take days off, you have to make up for the time that you've lost. That's what I had to do. Yeah, depending on your contract. Yeah. So I think you can bounce whenever, which is great. I think you can start preparing now and start looking for jobs. And if you feel ready, then you can just make the jump. But I think sometimes the grass is not always greener, you know. There are my friends in public health still that have way less patients than both of us with our experience, probably like 15. Okay. And probably paid less though, because that's just how the business works. But you still have the benefits and you still have a stable income. And it's not always stable in private practice. Like my friends in private practice it looks like to the public, to patients and to other dentists that, oh wow, beautiful office, beautiful work, beautiful marketing, and they got everything set up. But in reality, they don't take as much home because it's unstable. If you don't know what you're going into, that is, and they may sell fake promises, and then you're in a situation where like, well, it could have been better just to stay a little bit more in public health while you find the right opportunity. That's what I would probably do, knowing what I know now for my friends and myself, to stay in public health, use those PTO days to do working interviews, to figure out, and when you do working interviews, the most important thing is figuring out the schedule, if it's able to support you to make you super busy easily with new patients and stuff like that. And if how treatment is distributed between associate doctors or owner and associate doctor, and how that will work, and how treatment planning will work, how that will go from new patient and divvying out the procedure. So yeah, I really think like grass is not always greener. So it's hard to find a good situation, I believe, basically from what I hear online and with friends. So I think that's why people open up their own practice, because they're just sick of bouncing around from private practice, part-time associate gig from part-time associate gig. And you're like, man, if I put this much effort into like my own place that I'm building for myself, but then again, that's like more stress that are like, if we're even ready for.
That's a whole nother ball game. I feel like.
Yeah.
I mean, I've actually considered it. I've thought about it. I've looked into it, and the thing is, now that I've thought about the idea no longer scares me. So yeah, it could be something that I do in the future, not necessarily now. I think first, clinically, I need to get myself in a position where I can be able to manage bad, troubling moments with a patient, like if something's not going well and whatever, and then have, also office drama or office issues, and be able to manage both of them simultaneously before I can go and open up an office. Because if I open up an office and I'm working and then I'm having a stressful time with a temp, let's say, and then if somebody comes in and knocks on my door and says like, oh, something just blew out, or like this patient is an issue, or we got to talk finances, I'm gonna freak out because I'm already anxious.
Me too. Me too. I'm in the exact same mentality as you. Like, I'm thinking, how the hell can I manage anything else if I'm worried about the temp?
Yeah.
Exactly. Or impression and new patient, right? Like, how am I supposed to run a practice and worry about like the overhead? You know, give props to business owners. It's not easy. It's not easy.
No, it's a lot of work. It's not a quick solution. But there is more money in it for sure, but it also takes hard work. I mean, and it takes time to build. So Nothing is
Yeah.
easy. I've realized that. Nothing is easy.
Mhm.
Nothing comes easy. Everything requires time and effort.
Mhm.
It's just and this is what I was talking to with my friend on the last podcast with Ryan Coulon. He said we were talking about intentionality. Like we have to take intentional steps to
Mhm.
where we want to be. So like we have an idea of the dentist you want to be. Take the steps and put yourself out there.
You know that, man. This is so great. I love this conversation. So about intentional steps. I never did this before, but January 1st, I was like, you know what? I'm going to do it. I made a vision board, and I watched some videos on it, and they were talking about putting on your phone, and then when you make the vision board, you want to take pictures that are kind of like realistic, not like stock photos, you know?
Yeah.
So that's what I did. You know, I have it right here. It's on my phone.
Yeah,
So it's finishing the loan repayment contract, working in a nice office or owning an office, house, learning how to do full mouth rehabs, fitness right there, being happy, talking to patients, you know, building good relationships. And I think it's been a good reminder every day that's what I'm striving for. It seems so simple and stupid in simplicity, but like it helps. It helps a lot. It shows intentionality.
Yeah, it's not stupid at all. I personally haven't made a vision board. I've talked about it. I've thought about it. I just haven't sat down to make one. I do think ultimately, if you have a vision board, even though it's so simple, like you said, and so basic, it's a constant reminder. And two, you make decisions that open up doors to those things. So like you start gravitating towards things that will get you to those images that you see, you know?
Right.
So, because otherwise it just seems so far away or so unattainable.
Yeah, that's a really good point you made. Because each step, as long as you're going the right direction. Yeah.
I mean, it might not be, we don't know if it's the right direction, but it's a direction. And it's a direction that's going to bring you forward because ultimately if it's not that one, then you take a side step and you go to the next thing. And that eventually, whether it's a straight path or if it's zigzag, you're still going down the street, and at the end of the street will be your FMR, will be your happiness, will be the house, will be your fitness, and
yeah.
You're gonna get there. I promise.
Yeah, same to you, Ellie. Same to you. It's just the scary thing about leaving dental school is that you don't have the structure anymore that your entire pre-dental and dental life had. Right. And you kind of have to, the first time in our lives where it's like there isn't really a set path.
Right.
You know.
That's a very good point. I realized this, that everything up until dental school and finishing dental school was structured. It was like a goal, and we were actively achieving the next step, milestone. Check. Graduate. Then it's like, oh shit, there's so much uncertainty. Like now I have to fight for my income. Like, you know, even though you graduate with a degree that's supposed to guarantee you financial security, it doesn't necessarily. And it depends on where you live and how much, like the saturation. And I mean, like living in New York is very expensive. To live a good life is even more expensive. So it's like that fear of, and then the loans. I mean, you went to Michigan. I'm sure your loans are as heavy as mine. But like, it's scary because then you're like, oh, I don't want to not have money or to be short of money, you know? Yeah. But I think one thing to also be grateful for is we also live in the United States where we took out federal loans. I don't know if you did, but being a U.S. citizen compared to like here in coworkers where they had to take private loans, that at the end of the day, we can always just work at a FQHC, a prison, VA, Indian Health Center, get our loans paid back, and get a good salary, and get benefits. So there's that public service loan forgiveness, right? At the end of the day, like if shit hits the fan, we can still do that. So, but I think most of us just envision something different of our lives, you know? So I think that's where the internal struggle is. But I think we're
lucky as American citizens as a millennials to have this like the struggle of figuring out who we are and who we want to be.
Yeah.
I think our parents are thinking about survival, where like anything is good. Go for stability, and we want to dream, we want to achieve. So
Right.
I think that's the struggle we face.
That's true. I 100% hear you. I agree with that. Add in a layer of my parents being immigrants, like even more.
Same. Yeah.
So
Yeah.
they're for them it was like very easy. It was black or white, like, and for us it's like, but there could be more to life.
Yeah, exactly. Like, isn't that what our parents came here for, right?
Yeah.
So that we can have like everything we would ever want,
Right.
and to do whatever we would ever want. Yeah.
So hopefully you and I get to where we want sooner rather than later. But I'm really proud of you and the work that you've been doing. I've been following you. I've been watching your stories. I've been looking at your work and like the quality of it. And you know that. And I ask you for like tips and you send me videos on what to do. And so I'm trying to follow you, and I'm learning a lot from you. So thank you. Thank you
Awesome.
for being so available and so, responsive and so motivating.
Yeah. Thank you. I think it's important to have a big community and sharing, and just everybody's here to. I think someone else said, "Everybody eats" is a really good phrase or a comment on how like we just need to share with everybody, and we just feel better about ourselves and the community that we're in.
Yeah. Speaking of sharing, if anybody wanted to connect with you, where can they find you? What platforms are you on? Share your links.
I have a website called dentistryofsteven.com, and then I have my Instagram, dentistryofsteven, and that's basically where I usually am at on Instagram.
Yeah. Okay. I'll make sure to put that in the show notes. Steven, thank you so much for your time. I'm keeping you on a beautiful Saturday. It's beautiful here in New York. I'm sure it's even more beautiful in California. So I want you to go enjoy your day, but thank you again for being with us.
Thank you, Ellie. Appreciate it. Thank you for having me.